to
There we go. Good morning, everyone. Welcome to our special call right now for Global Health Ministries. And we're very excited for today's program as we're focusing on, again, the global health crisis and what we can do about it. And as you know, I'm Pastor Milhan. We have some very special guests here today. And I believe Phil will be joining us. I believe, fingers crossed, and offering prayers for that. But what we'll do is first introduce our speakers, and then one by one hear a little bit more, and then have a discussion on these topics. So we have here Dr. Mohan Adhikari, founder and director of the IFRE, which stands for the what is it again? International Relief.
It's International Volunteers.
Volunteers. Okay, IFRE Volunteers. He was a child born into poverty. Access to food, clothing, education, health was scarce. Having gone through such scarcity, Dr. Adhikari began to value the needs of those vulnerable communities deep within his heart, carrying feelings of both guilt and passion. And Dr. Adhikari shifted his interest from being a well-respected researcher at one of the best universities in the world, Tokyo University, to founding this organization, IFRE Volunteers, as an international volunteering organization aimed to transform the world by using personal experiences to help others who may not be able to help themselves. Dr. Adhikari's legacy as a philanthropist is truly remarkable and inspiring due to his commitment to serving vulnerable communities across more than 20 countries for nearly 20 years. By raising hundreds of dollars, thousands of dollars, he has managed to fuel meaningful and impactful projects such as HIV/AIDS clinics, houses for tsunami victims, orphanages, and building schools, which have helped over hundreds of orphans graduate from both high school and college. By serving tens of thousands of patients using volunteers from developed countries, the importance of collaboration and cross-cultural exchange is highlighted. This approach not only provides essential healthcare services to those who lack access, but also fosters mutual understanding and empathy between volunteers and the communities they serve. Dr. Adhikari strongly believes that by working with individuals who are willing to offer their time, skills, and resources, he has created a network of like-minded peoples who are committed to making a positive impact on the world by not only addressing immediate needs, but also contributing to building sustainable long-term solutions. So, Dr. Adhikari, if you can share just a brief minute or two before we go into the discussion, that would be great.
That's wonderful. So today I have just made a very small, PowerPoint presentation about first of all, I'd like to thanks to Global Ministry and Pastor Milhan and Phillips to give me this opportunity. And originally I was, I'm from Nepal. I born there, and I'm fortunate to educate myself in different part of the world. And once I completed my bachelor degree, I went to Australia. I did my master from Sydney University, and after that I went to Tokyo University for my PhD. That's a brief discussion about my education, and I completed my PhD back on 2000 from Tokyo University, and since then I started this mission work to help the people in different parts of the world. And I always, as I mentioned, I experienced the poverty when I grown up, and I can feel the poverty of people and their suffer, their pain. And once I completed my graduation, and I feel like it is most important to serve the community back in different part of the world. God may give some strength to help them out. Therefore, today I'm going to present a very short, make a very short presentation about. Mostly, I'm going to focus on health project in Nepal. I discussed, the program with Mr. Phillips before, and I'll just highlight, brief, about the health situation in Nepal. Let me share the.
Oh, actually, we'll come back to that. We'll just say hello for now.
Okay, and that's it for today, and then we'll discuss it later. Please,
yeah, we'll come back.
I hand over to next person.
Yeah, we'll come back. We're just saying hello for now,
Yeah.
and then we'll get more. Another speaker we have here is Miss Shauna King, and she's the president of the International Medical Relief. And I'm looking at their website now. They have missions all over the world, and she is the founder, and we're very happy to have her here. So if you'd also give us a hello, and also Carla Prentice is also here. So say hello to everyone.
Thank you. We're very happy to be a part of this wonderful program today. Thank you so much for the invitation. My name is Shauna King, and I'm the president and founder of International Medical Relief.
I am Carla Prentice. I'm the Vice President of International Medical Relief. We co-locate medical and dental teams all over the world. Right now, we have a team in St. Vincent and the Grenadines. They are teaching CPR as well as offering medical and dental care to populations most in need. Very excited to be here. Thank you again.
Fantastic. And also Dr. Hip, Stephen Hip was supposed to be here, although one of his family members had a loss, so he is not with us today, but sure he would love to be here. Could. Phil, hopefully will joining us too. He has a background in as an EMT. He joined our church about 1.5 years ago, and from the very beginning, he's been really wanting to launch this ministry that we're doing right now. And he himself is an inspiration. He struggled with mental health pretty much since childhood. But he has been able to overcome that and work in the field. And so his knowledge is so extensive. He knows, with a little bit of support, I feel like we could connect a lot of these organizations to the people who can volunteer and provide support. This is important to me. We can talk about God all day, but some people have very serious physical needs. And if those aren't met, what can we really, how can we talk about even love or these other things? I know Jesus always, he fed the people. And I'm all about that, feeding and healing people first, and then people can understand who God is. So again, so happy to have you all here. So maybe now we'll have each of you, if you can expand a little bit more on what you do before we go into the discussion. So maybe we'll start with Dr. Adhikari. You said you had a presentation, so maybe now's a good time to see that. And you said this was like maybe 5-10 minutes.
Yeah, it is very short. I'm not making it very long. And good morning again, everyone. First of all, I'd like to thank Pastor Mihan to give me this opportunity to present what is the medical crisis in Nepal and why more medical services is needed in Nepal. And today I'm only focusing on Nepal, but we have a program in different countries. I'll just give you some achievement pictures at the end. So this is a 5-6 slides over here. So about the medical current health situation in Nepal, if we talk about there are only, the total population of Nepal is almost like 30 million. And there are only 132 hospitals that include government hospital and community hospital and private hospital. So if we look the population and the number of hospital, you can, imagine the dire situation of Nepal. And as per the World Health Organization, and there's supposed to be one doctor among 10,000 population, but if we look the the condition in Nepal is there is a one doctor among 150,000 population, which is really, really dire. And I was also looking on, government data, and so there is a, 50,000, population within one nurse. So if we look the situation, the medical situation in Nepal is really dire. And when I was looking the data, and then more than 50% of the population, they don't have a health service. These are mostly marginalized population who live in hilly area, who live in marginalized area. There is no road, and to reach the hospital, sometimes in some places even they have to walk like 4 days. So in other words, if we talk about the conclusion on that one, and marginalized community, mostly they are poor and they are tribal, and they live in hilly area. And even if we talk about the very shortest distance, and then they have to walk at least 1 hour to 2 hours to reach the main road. From main road to the hospital is around 5 to 6, or sometime whole day. That's what the situation is, and road is extremely bad, and they don't get any kind of medical facilities in Nepal. That's one of the, this is the situation in Nepal right now. And from this data, we can figure out that how dark the situation in Nepal, and we can we can see that one. And if we are able to collaborate with this program, what we believe that if we collaborate this program, we would be able to serve the community who are marginalized, and we can offer them medical service. At least if we just talk about in Nepal, there are huge number of population, even they don't have access to Midol, very basic primary care medicine in Nepal. That's why if we are able to collaborate with this program, we can cover the huge population of Nepal, and at least they can get relief from the different kind of diseases. So I feel like we're going to have a main two goals over here. One, to offer the medical service to the marginalized community. Second things is that when we have international professional students and interns, and they can go and they can offer the service to them, and they will have exposed to the real ground situation, what is going on in different part of Nepal. That's the two major goal I can see over here, and we can offer service to them. And not only this one, just I'd like to highlight one of the things. We have been sponsoring hundreds of orphanages in Nepal, the place where I was born, and that property is donated to orphanages, and currently we have 25 orphans there, and we also have around 60, 70 orphans. They graduated, and that they are working in different different part of the life, and some of them are in the university, some of them are working in tourism industry, some of them are teacher. And then these all kids, they are come from this marginalized area because of the lack of facility. They lost their parents, they don't have anything to support. I just would like to highlight that one. And if we collaborate with this program, and I'd like to tell you what kind of framework or model we're going to use to reach that population. And then on right hand side, you can see the picture, and it is from these are the students from Macquarie University from Australia, and we run a program in Sri Lanka. And what was the framework we used that time was that first we collaborate with local hospital, and then this is mostly a government hospital, and then they organize. Most of the hospital, they do have an outreach program, but we also go and talk. We collect the data from our ground staff, and then we set up an outreach program with the collaboration of international volunteers, and then to local doctor and nurses, and then we reach out the marginalized community, and we offer different kind of program to them. We set up a outreach program in the community, not at the hospital. We go to the community and we go to the ground, and we run different kind of, it's going to be dental, dental clinic, just, removing the chatter. And in other words, just they mostly they do have a problem of eye. They do have a problem with the dental. They do have a problem with the skin, and they do have a problem with diarrhea and dysentery, and they do have a problem with fever. These are the major things happens, and of course, the malnutrition is the major malnutrition is the major factor over there. They get sick very quickly. So we are mostly using this kind of framework to reach out the community, marginalized community, and to offer the medical program. This is the model we have been using in different parts of the world, and that's what we have been doing since 2005. So after this one, I'd like to show you very briefly what we have done in different parts of the world. We run a camp in Tanzania. So when we run this camp in Tanzania, we had a group of doctors and students from Newark University. And when we run the program in Moshi area, and then Moshi is a small city, and then we run the program in it's called Longo area, and then mostly where the poor people lives. And we used to serve around 120 people per day. And then even the line was so long that we were overwhelmed with the situation. Similarly, we had a program in Kenya too, and then we run this program in a hospital, and we had a similar situation as well. And we run similar program in Peru at the hospital, and we serve the marginalized community mostly. If we go outside of Cusco, and there are area like a Tipon and Poroyo, and in those areas there is no hospital, and then even they are not educated about the about the hygiene or anything. We run different kind of program over there. And similarly, this is the medical camp from Australia. We run in Sri Lanka from Macquarie University, and we have been running every year in different part of Gale in South Sri Lanka. And this is the camp we run from Chicago University, and we were around 54 participants, and they were offering physical therapy, dental, hygiene, so many different kind of programs over there. And we served around 7,000 population at that time, and it was a 2 weeks program over there. It was so wonderful, and we were able to help them lots. Similarly, this is a camp in Nepal. And this was a vaccination camp in Nepal. We run it, and we vaccinated more than 9,000 people. And that is mostly, people as well as children. That include the polio, different kind of vaccination we had run over there. And this is some of the achievement we have, done in different part of the world. And just I'd like to conclude my short presentation to you. And if you have any question, anything you'd like to share with me, that would be wonderful. And I'd like to thank Mr. Phillips and Pastor Mihan to give me this opportunity. I really thank you all. This is the end of the presentation.
Yeah, thank you, Dr. Adhikari. As God answers prayers often, here's Phil. He's arrived. So I will hand it to him to say a few words and also thank our speakers,
sure,
etc.
Thank you, Milhan. I just want to thank everyone for attending today, especially Mohan from IFRE Volunteers, who we have officially formed a partnership with the Global Health Ministry of the Manhattan Family Church. Also for Shauna King and Carla. I'm sorry, Carla, I forgot your last name. I apologize.
Prentice.
No worries.
Prentice, I apologize. Carla Prentice for attending. I also want to say we did have another speaker that was scheduled to speak today, but unfortunately his wife passed away on Sunday, and he is attending the funeral today. So if we can all say a prayer for Dr. Stephen Hipp and his family tonight, it would be appreciated. And our deepest condolences and sympathies goes out to Dr. Hip and his family as they deal with this crisis. Basically, just to introduce the Global Health Ministry real quick, the Global Health Ministry started, the idea came to fruition about 2 years ago, back when Pastor Milhan first came to be our pastor at Manhattan Family Church. There was a whole, 7-page proposal that I did for the ministry. And last year, it started out as the Mental Health Ministry, because currently in New York City, across the nation, and around the world, we are dealing with a crisis of mental health issues, especially here in New York City among the homeless population. According to the latest statistics from the Office of Mental Health and Hygiene, approximately 60 to 70% of all homeless population in New York City and state are either alcoholics, addicts, or dually diagnosed with a substance abuse issue as well as a mental health issue. So the global health crisis originally started out as the mental health ministry. Then approximately 6 months ago, we pivoted and decided, since mental health is not just a New York City issue, it's not just a United States issue, it's a global issue. And it's also part of a person's overall physical well-being. So we changed the title of the ministry to the Global Health Ministry. That's when I started reaching out to people like Mohan and Clara to see possibly how our ministry can help not only locally and nationally, but globally as well. And Mohan, Clara, thank you so, so much, for all of your patience and attention and just loving support that you have given me. So with that, at this time, I would like to introduce Carla Prentice, who is the Vice President of International Medical Relief. Sorry. Oh, Shauna wants to go first. Okay, I apologize.
No.
We're a team. We can do this together.
Yes.
Okay, so
Yeah.
I'll announce you first, Shauna.
Oh,
Shauna King, who is the President of International Medical Relief, a non-governmental organization that reaches out medically across the globe. And with that, I give you Shauna.
hi, thank you so much. Welcome. I really greatly appreciate the opportunity to be here to talk to you all today. International Medical Relief was founded in 2002 on the principles and beliefs that everyone globally deserves access to healthcare, regardless of where you grew up, where you were born. Everybody deserves that access to care. So we have been serving communities worldwide. We do approximately 150 medical mission trips a year. We work in 87 different countries. We're a $70 billion organization. We have about 60,000 medical volunteers that are ready to deploy with us on our different mission trips. We respond to disasters as well. So we've been working most recently in Turkey with the earthquake there. We spent a year in Poland working with the Ukrainian refugees. We did, respond obviously to the Nepal situation as well back when the Gorkha earthquake hit. So responding to disasters is something that we do. We're part of the disaster area response team. We're also part of PAHO, the Pan American Health Organization. So working on behalf of the World Health Organization's EMTs. So we're always having teams in the field. So every week there's a group of different teams. We work all over from Asia to Africa, South and Central America. All of our teams have some of the same components in terms of a lot of education, community-based education for medical personnel, as well as community members. And we co-locate medical and dental teams. We also do specialty clinics, whether it's surgical or an eye care team, dermatology team, orthopedic team. So we are ready to deploy different kinds of specialists all over the world as well. So really excited to be a part of this conversation. We've treated over 750,000 patients in the last 21 years of service, and looking forward to continuing to do more good.
Absolutely. So I'm just going to add on a couple of things. Shauna has started an amazing organization that gives volunteers from around the world an opportunity to serve, bring forth their scope and skill set. Shauna founded IMR on the fervent belief that every single one of us have talent that can bring impact to communities. So we're working every single day to make sure that that impact is growing around the world. We are not only co-locating medical and dental teams, but we're also adding components of education. So yesterday we taught 24 community members CPR in St. Vincent and the Grenadines. We teach immigration officers, we teach cops in Guatemala, we taught the bomberos. We're always looking to grow the infrastructure of the communities in which we're serving. Our job is to work ourselves out of a job. We partner at the request of ministries of health. We partner at the request of local health officials. We never go where we're not invited. We always go in under the umbrella of someone who has the authority to maintain the public health of the communities that we're serving. As Shauna said, we've responded to disasters year after year. I myself was in Turkey earlier this year for a couple of months following those devastating quakes. Our job was to get him to a place where the Turkish doctors could take over the hospital that we started, in which they did. Our commitment to Turkey does not end following the initial tragedy of the earthquake. We're committed long-term to building resources, finding partners and collaborators that we can work with that builds their infrastructure is our #1 goal. So very excited to be in this conversation and know for sure that we can go further together, bringing together organizations that can all bring to the table their specialty and expertise really grows our impact in the field. So we're excited.
Even deploying in the United States, we work in disasters here as well. We worked with the Hurricane Katrina in Louisiana, Mississippi. Most recently, we responded to the COVID crisis here in Colorado, where we worked with the State Emergency Operation Command under the direction of Governor Polis, our governor here in the state of Colorado, managing the COVID operations in all of the vulnerable population shelters. We worked with the state of Colorado, the city of Denver, maintaining the health services in all of those shelters 24 hours a day, 7 days a week. We also helped to COVID test and screen any visitors to the Capitol, as well as special events like the State of the State when the Supreme Court had to come. We also helped with the vulnerable Ute tribe in the Indian populations where they really needed some care and guidance. So the governor and the State Emergency Operations Center had sent us down to the tribes as well to manage their COVID operation response. So just wanted to give you a little bit of our at home. We are not just abroad, but also right here in our backyard.
Absolutely.
That's absolutely fabulous. Thank you so much, Shauna and Carla. I just want to announce or state to everyone that the Global Health Ministry and International Medical Relief have formed into a cooperative partnership and are working on forming a potential response partnership, as well as sending healthcare workers who are trained by the Global Health Ministry with IMR out for their medical clinics abroad. So I just want to say again, Shauna, Clara, thank you so much Carla, I give you special props. You know, you've put up with, you know, all of my phone calls and everything. So I thank you. You know, if anyone also, Carla, if you could say a little bit about the efforts you have going on with the Hawaii response. Back last Wednesday evening, late in the evening, there was massive wildfires on the island of Maui that destroyed a good portion of the island, or I should say destroyed or severely damaged it. There are thousands of people who are currently homeless, without power, without food, without shelter. The Global Health Ministry is currently putting together a response to this disaster upon approval from the Maui County Office of Emergency Management, the State Emergency Management Agency, and Governor Green's office. We will be releasing a press statement possibly sometime next week once it has been approved by leadership. And anyone who wishes to partner with us can call me at area code 917-933-4802. That's 917-933-4802. Or they can email me at M as in Mary, H as in Henry, C as in Charlie, Global Health Ministry, all one word, at gmail.com. Again, that's M as in Mary, H as in Henry, C as in Charlie, Global Health Ministry at gmail.com. Again, also I want to apologize for my tardiness. Anyone who's ever visited New York City or lives in New York City can understand how unreliable the public transportation can be in this city. You know, especially, you know, with the renovations and construction going on. So, and I just want to state, you know, that the residents and government of Hawaii were there for Connecticut, New York, and New Jersey during Hurricane Sandy. So now it's time for us to return and repay the favor. Aloha to everyone, and thank you very much.
And it looks like someone's joining us here, possibly a specialist in this.
Is that Toshie?
Thank you so much, Nofi, for allowing us to be here. And thank you so much for your dedication and commitment to family and returning some favors. Sorry, our phones are going crazy. For the people of Hawaii. International Medical Relief is committed to not only the people here at home, but the people abroad and our family in Hawaii. We are very fortunate to have our clinical coordinator. His name is Philip Kabala, PJ Kabala. He is a nurse and he is from Hawaii. A part of his family back home is suffering through the tragedy that's ongoing now. And I thought that he, being in contact with them as well as disaster responders, might offer great insight into the happenings on the ground. And then we'll talk about what International Medical Relief is committed to doing for this disaster. Would that be okay?
That would be absolutely perfect. I just want to say that this response effort is in the beginning stages. I have spoken with both the Maui County Office of Emergency Management, as well as the State Emergency Management Agency and Governor Green's office. At this time, they have asked that we can go ahead and continue collecting non-monetary donations, but not to send them to Hawaii until requested, through official channels. So at this time, the Global Health Ministry is collecting cash donations only from the general public. we are in the process of forming collaborative partnerships to be able to collect and disseminate any non-monetary donations from our church members and our affiliate churches if they so wish to participate. And again, I wish to thank Shauna for agreeing to be a distribution hub for us. That will greatly assist. One of the organizations we are working with is a very well-known organization, or I should say that we're in talks with, and hopefully we'll be able to come on board.
We'll definitely get the word out.
Yeah, we'll definitely get the word out.
Support any way we can.
But they're small aircraft pilots, so.
Was Philip gonna say something over at IMR?
Yep, go ahead, PJ.
Okay.
Hello, everyone. I just want to say thank you for taking time out of your day and also helping the Kokua you guys have involved with helping the island of Maui. Thankfully, we have IMR alumni who's there, who's local. My old coworkers who I've served with IMR with, they're currently there in Maui right now serving. As with many disasters, the right hand doesn't talk to the left hand. So there's a lot of structure being built and a lot of organization phases being built now. And with most disasters, whether it's local or internationally, everyone is helping at this phase of the disaster. In the upcoming weeks, a lot of those organizations will be depleting and will be leaving Hawaii. And that's when really the help is going to be magnified for the locals who have been affected by the disaster. And hopefully, in collaboration with you guys all on the call and with us, we can provide that help in a timely manner.
Yeah. Well, what we typically do is we'll take a story like this, we'll write a story on our website and let people know exactly how they can help, monetary and non-monetary. And we'll start with a lot of things start here in New York and then we expand to the nation. And we have our church all over the world. So we'll see how we can help.
Yeah, our church's headquarters for the United States is located here in New York. That's kind of why, New York is the center of our universe with the church. And to you, Philip, I just want to say, mahalo. Thank you for your service. Carla, again, thank you for your service. And help me. The president, Carla, and Sean. I'm sorry, Shauna. It's
Yeah, he
been,
doesn't have his glasses on. He can't see the screen.
yeah. Also,
That problem too.
also Mohan, thank you. For those who have come in to participate in the event, thank you. And if any of our members from the Manhattan Family Church wish to give a donation, please bring it with you to a Sunday service and we will store it here in the basement temporarily till we ship it out to our distribution partners.
You can put it on a pallet.
Yeah. I just want to say also, as a last resort, I'm working with Governor Green's office, and it's depending on how many and how much donations we get. But I'm currently working with the governor's office to see about the governor requesting through our state's governor, the Air National Guard place a C-130 on standby to transport supplies. So
yeah, we can. Well, once we get the story goes out, we'll definitely share it with you so you'll know kind of how we're approaching this. Thank you so much.
That'd be great. Thank you, guys.
thank you all so much. Are there any questions for any of the panelists, myself or Pastor Milhan?
Yes, hello, Philip.
Hello, how are
Good
you?
morning, Reverend Pastor Stevens.
Hi, Mama.
Morning, Philip. Morning, brothers and sisters. Morning, panel. Morning, everybody. I just want you to go over that part you said about the non-monetary,
So
the donations. You could bring them to church and you would store them in the basement or something like that.
Mama G, what we'll do, we'll send the story out so it's very clear what we're asking for. Because I know this is evolving too. We want to make sure that we have the right information when. So, but But we're going to take, what we're going to do now, Phil, is going to go into a panel discussion. The way I like to do it is start with heaven and then go to the earth. Meaning we'll start with, I'd love to hear what your vision is for our guests today, and also how we can be involved. So again, the Global Health Ministries, this is, Phil is our director. I'm the pastor, so I oversee all these ministries, and I like starting small and being able to grow as God will give us the blessing to do so.
Yes, amen.
Now, the mission of Global Health Ministry is two things. Number one is to raise awareness of the global health crisis. Okay, even that alone is a big deal. I think I'm not aware enough. I'm learning a lot from Phil, and I want to share that with other people to know, wow, there is so much, there's so many ways, or there's the fact that people don't know there's a health crisis happening. The mental health crisis you can see on the streets here, but it doesn't stop there. The second one is to increase the medical capacity. So in small ways, big ways, but just to inch towards a better situation where people don't have to worry about getting comprehensive care.
Where they don't have to walk 300 miles to the closest hospital, or take 2-3 days to get there.
Exactly. I have 3 kids, and I've had many cases where I needed care and I called an ambulance to my house. And if I can't imagine not having that, not just the ailment, the illness, but also just the stress of
The difficulty of accessing healthcare.
and it's hard for anyone to find God when you can't even, get your situation together. So, sorry, Mohan, you wanted to?
Yeah, even not that one, just I'd like to share one of my experience in Kenya. And we are running program with Maasai people in Kenya. And how small knowledge, disinformation is really fatal. And mostly what was happening within Maasai people is that, they used to feed animal fat to, baby born. And because of that reason, the fertility rate was really, really high. And we are running a program. It is most like a awareness program over there. And we run in the area called, Maasai. Maasai land is not Maasai Mara. In Maasai land, there were a population of around 15,000. We run awareness program for them, how to feed, babies. And then we start to collect the data, and they says that, they used to feed a lot of animal fats, because when they kill the cows and they collect the fat and they feed kids, and then we educate them how the animal fat will contribute towards the fertility of the baby born, because they cannot digest that fat immediately. And even there are so many lack of knowledge within the population, and there are millions of population like that. Once we started that campaign over there for 14 days, now they don't they don't feed baby born the animal fats, and only that kind of education make big difference in human survive. That's one of the example. And another example was, we were also helping, orphans. And then what I had, even she was a nurse at the orphanage, and she was using same wiper to so many, kids. And it is very easy that, if one of the kids, she has a, viral infection that can be transferred very easily to others. We can go with very minor education, and that make a lot of difference in human health. And similarly, in terms of food, and there are food crises in different parts of the world. Even it is available within them, and they do not educate the population. And that's the example in Nepal.
This is what I love about what you're doing, Mohan.
Yeah.
Because
Okay.
you look at it comprehensive, like you can look at the medical and then you realize there's a food issue, there's an
Yeah.
education issue, there's
Yeah,
communication issue. And
yeah,
I see how you have you look at it comprehensively, and that's music to my ears because with Family Federation, we put God and family in the center of society.
yeah,
When you do that, then you start to see everything else, and
Yeah.
when you address one thing, but it can also have an effect on other things.
yeah. It has ripple impact in other things. That's what I have seen while I'm traveling and then to go and work in real in ground situation.
Yes,
I have
and then
so many different example of different cases, HIV/AIDS case, education, case, nutrition cases. Even I just give you example of even nurse, she was using same, wiper to so many different kids, and then it's so
Right.
many things it can be done as we have discussed.
And that's the level we have to get to. I my background's in food science, and I learned one of the first things you learn is in, like, what I said, 1906, The Jungle was published. I forget the author's name, but when people learned the reality of the food industry, they realized all these laws were starting to get passed, et cetera, et cetera. But something that Carla said I liked also was you're invited wherever you go. And that alone says a lot about the nature and the whole, looking at the whole picture and the kind of care and respect for the existing, country's culture and how they do things. So again,
Yeah, absolutely. There's a lot of countries all around the world that need help. There's a lot of organizations, such as International Medical Relief, that just want to go and help. The same thing that's happening with the Maui wildfires. Everybody wants to go in and help. We probably get 50 to 100 calls a day of alumni just saying, send us in, send us in. Right now, they're requesting that we don't send in medical volunteers. Let's do this in a strategic manner. The rollout of disaster response is very complicated, and it has to be coordinated by those on the ground. IMR never believes that we know everything. We want to come in and be the savior. That's not the way we work. We are partners in the process of collaboration and impact. So we're going to be there. If they need money, we're going to try to solicit donations from our alumni. If they need medical supplies, we're going to call every supplier. We're going to work 20 hours a day and make sure that that happens. But we only do it at the direction of them. It's not about IMR's agenda. It's about our partner on the ground.
And when you talk a lot about global health and the limits and restrictions, I think one of the things that's going to really help global health as a whole, especially in limited resource settings, is the advancements in technology. So I spent the last 3 years at Harvard Medical School as part of their global health team looking at AI and technology, and International Medical Relief has rolled out a lot of technologies that will help level the playing field for access to healthcare for everybody around the world. So even on every trip that we have, we're deploying new technologies. We instituted a training session in Jaipur, India on a hologram, a 4D hologram machine, which will help put the doctor and the patient right there together. Carla has been deploying telemedicine with a lot of our advanced practice specialists in the field, where we're able to do video calls live from our clinics. So we can bring the experts right there to, a community right in the middle of a desert, where they can have access to the same specialists and doctors that everybody has. So I think technology is really leveling how we look at global health, making access easier, especially when you bring technology and advancements like that into it. And International Medical Relief is committed to advanced technology on all of our deployments to make sure that we're offering the best to all of our communities, and that every clinic has access to the same skill set. So even if we don't necessarily have an OBGYN expert on a team with us, we can contact one. We have those experts available, ready to talk to us. We work, Carla's son is at Henry Ford Health System, and we have a great relationship with a specialist there from the Global Health Department, who's an infectious disease specialist, who's helped us on a lot of our virtual calls and video calls, where we can get that advanced diagnosis so that we can treat those patients right there. So we're really committed to helping how we can look at this healthcare crisis in a new way globally and using technology to really advance the work that we do.
That's absolutely awe-inspiring.
Yeah.
Absolutely awe-inspiring. Just to give a little bit of my background, I was a emergency medical technician for 23 years. And I just recently recertified my EMT card, and 99% of my career was spent in the voluntary sector, as a volunteer or as an employee of a volunteer service, or a township, so one thing, because, prior to me becoming an EMT, I was a volunteer with the Red Cross during Hurricane Andrew back in 1992. And I saw what it was like when people just decided, oh, we're going to self-respond without any, official, authorization. And it was a madhouse, I've spoken with the director of communications from the Hawaii Office of Emergency Management. And, he is like, please, if you're going to send donations, we're asking people, cash donations. And I'm like, well, we have one organization that's already started collecting, but it has a warehouse, that they can store it, that we're cooperating with. And he's like, okay, well, if you want, go ahead and collect. But at this time, they are only accepting cash donations, directly to the Maui Relief Fund. So you can also donate to the Global Health Ministry at, at our website, which is
You go to ManhattanFamilyChurch.org. ManhattanFamilyChurch.org. There's a link there at the top where the ministries are listed. You can see Phil's picture there, the Global Health Ministry. In the interest of time, Phil, if it's okay, if we can kind of first ask if it's okay, can we extend 10 minutes? If not, we can always wrap things up. We did start a little bit late. Is that okay? If not, we can. I'm seeing some nods. Is that all right? Or
Sure.
10 minutes? Okay, I promise no more.
You have a hard stop in 10 minutes, though.
Hard stop in 10. Yeah, maybe we'll do it in 7. So we talked about kind of the vision. It sounds like we're looking at comprehensiveness, good cooperation, communication. That's beautiful. I think that's the future. AI. I mean, everyone's got AI plus something. I'm also looking at, even in ministry, I totally use AI. If I want to reduce crime in Harlem, I use AI. I mean, there's all the research that can be done there. So I'm so excited to hear that. I think that's a good way to attract more young minds to work in the medical field. Now, the second question is simply, how can someone today get involved? Or what is their first step to be more involved and support the volunteer efforts that, or, start a career in this field? We also have a lot of young people who aren't sure about what to do. They all can't be YouTubers, so they need to look at something that will exist 10 years from now. I know AI is taking over a lot of jobs. So so tell me, what should we inform our younger members or older members, how they can be involved or take steps towards that?
I think that the main thing is just to be involved. So just to not sit on the sidelines and to read about it, but to volunteer. It doesn't necessarily take somebody going overseas to be able to participate in global health. People can come to Colorado. They can work here at our shelters. They can work in our warehouse. They can help, doing things volunteer by raising support or spreading the word or connecting groups who are interested in doing that. So it takes everybody to be able to participate. But one thing that's important to note is that even on an IMR trip, not everybody that is deployed is medical. So 50% of the people that go on our trips are non-medical volunteers. So just to be able to run a community-wide clinic and training and education program, it takes a lot of hands. So everybody is welcome. So you do not have to be a doctor or a nurse in order to go on a global health medical mission.
100%. I think aligning your passion with a purpose, finding how and what disaster or project you want to get involved with, and then just finding out how you can be of service, whether that's a supply drive, you know, in the midst of a disaster, there's still everyday life that has to happen. So a lot of people who go on disaster deployments are like, oh, the patients had eye issues and lost their reading glasses, or the kids lost all their toys. The problems of everyday life are still there with that disaster component layered on top. So finding a way where you can get well cards to someone who's sick in a developing country, or just thinking about you cards so people know that people around the world are involved in their journey with them. I agree with Shauna. There's a room for every single person on a disaster, or just in our everyday work of growing impact.
I'd like to raise one of the very interesting things in terms of participating in volunteer work. We deploy around 1,000 volunteers per year in different parts of the world, and I was wondering why the number of participants are mostly female than male. Out of 100, we have only 10 males and 90s are female. Is that the female has more kindness, or I really don't know. That's very interesting to us. I haven't run this one for
Bigger
last.
hearts.
I think their heart is really soft. I really don't know, because a lot of males are not really interested to involve in a volunteer work than female.
I honestly believe that it's the way that we're all raised, right? Men are supposed to go out. I think in the changing times since the 50s, we've gotten our male volunteer numbers up, but they're solely focused on things here that are in front of them, I believe. And I think that sharing the story and telling it in different ways, we're getting our numbers, probably 30% are male volunteers in the field. We just had an all-male team, which we've never had ever serve in Warsaw, Poland. So shout out to the guys who are presenting, but PJ's a male nurse. Having people that look like them go out and talk about the importance of that. I think changing that narration of it's okay to leave your job, it's okay to take vacation, but they're also the breadwinners of a lot of their families, and they just have a lot of things going on.
I'm always big about it because I carry my baby around everywhere to make a statement that it's not, I don't have to do it mama's way. I can do it papa's way, but I'm doing the work. I'm putting this family in the center. I'm putting, people's needs in the center, but just doing it my way. I think that's also, it's different. It's like a different bedside manner. You know what I mean? It's I think maybe that hasn't been so clear. Maybe.
Good for you.
Okay.
Okay. Maybe we're kind of coming towards the end here. I think that's but Mohan, did you want to comment on how someone can get involved or take steps towards increasing medical capacity?
Soon I'm leaving from Nepal because we are building an orphanage in Nepal. So I'm leaving on the middle of September. And if anything's come up, I'll definitely would like to share with you.
Understood. So it's a conversation that needs to be had.
Yeah.
Wonderful. Okay. I think, Phil.
I want to say again to Shauna, Carla, Mohan, thank you very much for attending.
Thank you.
You guys have been,
a rock. You might know that, right?
I'm sorry?
You have done this one. It has a very spiritual meaning in Hinduism. It's called Hinduism, but it has a very real meaning. Why they do namaste.
Namaste.
Well, I believe, and correct me if I'm wrong, Pastor Melhan, Father Moon, who was the founder of our church, he spent years researching, all the different religions, and, bringing out, the best, parts that every religion has. So
as we all seek the truth and love, we'll all find ourselves in the same place. That's our fundamental belief. Hence the unification church we believe in.
That's correct.
But only as we pursue truth and love, we will come together. Otherwise, we'll just be in our own silos.
That's correct.
So that's what our thing is. Again, this has been a
you
wonderful,
so much.
inspiring chat, and I look forward to hearing, following up with each of you and through Phil.
Absolutely.
And with that, thank you again for joining all of you. on
Thank
the
you
call.
so much. Thank you so much for giving this opportunity.
And Carla, I will be giving you a call later this afternoon. I have an update for you, if I may.
Perfect, thank you.
Okay, all right, thank you. Thank you all
Good
again very
Thank you.
much.
Okay, thank you. Have a
Bye.
wonderful day. Okay, bye.
Have a blessed day, everyone.
Bye-bye.
Okay.
Thank you, everybody. Have a good day. Thank you.